Thank you, Twee, for creating a new form of backdrop, which enables us to see who we all are and to be reminded of that. Thank you. Super. Twee, we'll come to you in a minute. We'll just wait because people are gathering. David Nabarro here, welcoming you to our open online briefing. And I want to, as always, give a brief summary of what I think is happening in the COVID world. And why do I want to do that? Because there is such a lot happening. Whether you are looking at COVID from European eyes, North American eyes, Latin American eyes, or African eyes, Asian eyes, and Middle Eastern eyes, is a lot in COVID right now. And it's because, as I think everybody knows, there is a really extraordinary resurgence in Europe, and it's not quite doing what we expected it would do. So the European resurgence needs some attention. The North American surge on surge, also we need to look at. Then we got to go briefly to Mexico and to Latin countries like Brazil. We should go there and look. We should go to South Africa again. We should go to Pakistan and India and other Asian countries. We should look at the Middle East. We'll do it fast because we've got lots to do. And then once we've looked around the world of what's happening with our COVID, then we need to think hard about how countries are responding. We've said time and time again on these briefs that the secret is to be able to interrupt transmission. Let's ask ourselves how interrupting of transmission is going, and also what's happening when the surges build up and you get a really significant outbreak. What happens then? How are European leaders responding to their surges right now? How are European businesses responding? Let's have a quick look at that. And then, having looked at the sort of big picture, let's take it down to ourselves. Let's think about ourselves as actors in this response. Let's think of ourselves with our families, with our work colleagues. Let's also think of ourselves with perhaps more susceptible relatives, older people who perhaps got other conditions. And let's think of what this all means for how we behave. Let's think of the next 6 months, January 2021 through to June 2021. What's going to happen? We have to then bring the vaccines into the picture. But there's more than vaccines. There's prevention, and there's treatment, and there's trying to make certain that we protect those who are most in need. Remember that now long COVID is being recognized more and more. How do we help people through their long COVID? And also, let's do everything we can to think through what happens to other health challenges when COVID is taking up so much attention. Let's think about mental health of everybody, and let's think about health personnel and people who are working in care facilities. We'll do that. We'll do that super quickly, and then we'll talk with each other. Twee, did you want to just do a quick check-in with everybody? It's just you're very big on my screen, Twee. I have to come to you.
I promised last week that I'd have a surprise this week. That surprise is not something I've done, it's someone. And so I'd like to welcome and give the floor to Nazim. If you've been joining us on these briefings for some time, you will know that Nazim has been an incredible champion in the arts for COVID as well. And you may have heard his song, the COVID Ready Anthem, as well as Test, Trace, Isolate, Protect, and his latest, Be Kind. So Nazim, I give the floor to you. Please tell us how the year has been for you as an artist, and please share with us one of your songs.
Oh, thank you, Tweet. Thank you, Nazim.
Hello, everybody. Hello, Nabarro. How you doing?
I'm good, Nazim. Call me David.
Hello, Tweet. Thank you for this awesome surprise. You know, I'm always happy to be home because I can always say this is where everything started. And you, Dr. Nabarro, you opened for us to spread the message out there through music, and we really appreciate it. We so much appreciate it. And thank you to you, Tweet, and everybody else who's watching today.
So beautiful.
It has been a challenging year. It has been a challenging year for musicians and artists in general and everything, you know. It has been really difficult, especially during this time of the COVID-19, you know. But from my side here in the Gambia, we have contributed, you know, to the fight against COVID in a very, very strong way by bringing out loads of COVID songs, you know, sensitization songs and everything, you know, which has really helped. You know, and COVID really gave hope to the people of the Gambia. And after test, trace, isolate, people started getting tested, because at the start of everything, people were being in denial of getting tested because of the fear of the fact that if you get COVID, the stigma and everything, you know, so it has been tough. It has been really tough for everybody. But without wasting much time, I'll do the first surprise. All right? The first surprise is called COVID Ready. It's going out to you, Dr. Nabarro, and your entire 4SD team, all right? For a work.
Thank you.
Great job. We appreciate it. Yeah. Let's have a good time. COVID-19, oh, it is real. It is real. Oh, it is real. People dying, oh, heavy way. People crying, oh, heavy way. People suffering, oh, heavy way. Our communities, doctors and nurses, yeah. The choice that you make now can decide the future. Things that you do now can make a difference. We don't want to suffer more, don't want to struggle more. We don't want to suffer more, even like this. We don't want to suffer more, don't want to struggle more. We don't want to suffer more, even like this. Our communities must unite. Our leaders got to unite. Got to be ready. Let's make ourselves ready. Go be ready. Go be ready. The choice that you make now can decide the future. Things that you do now can make a difference. We don't want to suffer more. Don't want to struggle more. We don't want to suffer more. Even like this, we don't want to suffer more. Don't want to struggle more. We don't want to suffer more. Even like this. Yes, we can. Together, one word, we will succeed and overcome. To all the doctors, all the nurses, we saying thank you. We will never forget you. To all the doctors and all the nurses, saying thank you. We will never forget you. COVID-19, oh, it is real, but we are realer, and we are stronger, and we will conquer. Thank you very much. Thank you.
We sing this and hum it all the time. It's kind of got right into our beings. Your beautiful song, particularly this anthem, which is just so
Thank you very much.
So good.
Thank you very much, Nabarro. Thank you so much.
I wish you'd call me David, but I mean, you have to decide what to call me. It's just my name.
Okay, David. Thank you very much, David.
Thank you, Nazim.
Thank you.
But it's amazing
that
you're able to give us your amazing song by guitar. I presume you're in the Gambia. I mean, it's amazing, and that it worked. And there is Chris. Chris is sending you lots and lots and lots of claps. I'm sending you all the claps I can find. And,
I'm seeing the comments. Thank you guys so much.
We love it. Don't we, everybody? We love Nazim and his music and his words. We think that's probably a really amazing combination. And keep it up, because this is going on. Thank you.
I will. Thank you.
Thank you very much.
All right.
Right. Brilliant. Thank you. Thank you, Nazim. Oh, Twee, what more surprises have you got today?
There's just one more.
One more.
At the end. You give me a few minutes at the end.
Oh, okay. Okay. Isn't it nice? Iman says that she wants it as her exercise tune. I think it's such a good song, and it doesn't go out of my head at all. It's there. So beautiful. So I am going to talk a bit about the pandemic, because actually, don't let anybody tell you that it's somehow finished. It is not finished. You know, there are now enormous numbers of cases each day being reported to the World Health Organization. Yeah, more than 500,000 some days. And I want to stress to you that if we look at the overall global numbers, 70 million cases reported since this started, and more than 1.6 million people have died. And although we keep hoping that the numbers are going to plateau, it's not plateauing. It had a rapid acceleration during October, and then it slowed, but it's picking up again now. And that's because this virus has not gone away. It is spiking, it is surging, it is swirling. And that is something we really need to remember. Basically, it appeared in a second wave in Europe, really in September, October. And then European nations slowed everything down to try to bring the numbers quickly down towards zero, but they didn't come down to zero. The numbers have held up in UK, in Germany, in Netherlands, in France, in Spain, in Italy, in Switzerland, in Sweden, and in other Scandinavian countries. And what does this mean? This means that, unfortunately, this virus is finding it quite easy to spread itself around, given the current ways in which humanity is trying to get on top of it. And what does that mean? It means that we've got to be really, really careful in Europe during the next few weeks. In my view, it's not a cool idea for people to start meeting each other in their sitting rooms, in a cold environment outside and hot, often stuffy environment inside, perhaps together for 2 or 3 days because the families come together to celebrate. It's just the right conditions for the virus to spread. And right at the moment, there are people with the virus who don't know they've got it. They're either spreading without symptoms or spreading before the symptoms come on. And these are the conditions under which older people who've been looking after themselves so carefully to try to avoid their COVID are going to end up getting infected. Or younger people who've got other conditions, or younger people who just anyway will get infected and will then go on and develop long COVID. So I'm becoming one of those slightly dull people, what we call a killjoy, who's saying, if you possibly can, be really, really careful. Even when you are with your loved ones, do the distancing. Don't think, oh, well, now I'm here, I might as well go up and be close. Keep that 2 meters, keep that mask, keep the hygiene up. And if you're feeling at all ill, do not meet your relatives. This is my Europe request. It's interesting, I'm not the only one saying this. Here in Switzerland, we've got a big dispute between the cantonal administrations and the Federal Council, with very passionate debates about what should happen in this country. In France, there are big issues going on. Noemi, you might want to mute.
David, you've now muted yourself. You're still on mute.
Thank you. And so in France, there are questions about what to do. In England, there is a big issue about whether 3 households should be meeting together. It's really a pretty acute debate underway right now, all over Europe. In the United States, the situation that I've been describing for the last few weeks has continued, and we've got over full hospitals. 85% full in a hospital in the US means a full hospital, because there's very little capacity to cope with more than about 85%. There just aren't the staff. There aren't the staff to provide the cover needed. And so the North America situation is particularly difficult. Latin America, difficult. And my colleagues are telling me the resurgence is happening in different parts of Africa and Asia and the Middle East. So all that I have to keep saying is we have to maintain our very high level of alert, our very high level of respect for this virus, our very high level of precaution. And we must remember this virus is particularly unpleasant, and long COVID is not a trivial thing at all. So we have to continue to be able to interrupt transmission. John told us last week that he's studying aspects of transmission interruption in the UK. Isolation is not good enough. People are not isolating adequately, and transmission is continuing, despite the fact that people are positive and know they ought to be isolating. If we look at a big difference between, say, France and Singapore, or France and South Korea, when you are asked to isolate in South Korea, you are isolated. That's it. You are not allowed out. When you're asked to isolate in France, there is no supervision. It all depends on you. I think that's not good enough. If you want to interrupt transmission, isolation is the key. If you want to interrupt transmission, contact tracing is critical. If you want to interrupt transmission, you have to be able to supervise the isolation. Otherwise, you will not get the numbers down. And that's why we've got these numbers sticking in Europe at the moment. Why, I ask myself, why is this happening? Why? And the answer is a real concern on the part of European political leaders that if they do insist on supervised isolation, that this will result in pushback from the public, that somehow it is thought not to be acceptable. I just don't agree. I think more and more people in Europe are actually wanting to get on top of this virus. They know that in East Asia, ways have been found to do so. I think more and more people in Europe want to say to their politicians, please don't have Christmas as an opportunity for people to break the rules. You know that by late January, there will be big spikes. We will go on with this terrible and unsatisfactory situation. Why don't we sort it out once and for all? Get the necessary transmission interruption in place. Get the necessary respect by everybody for these rules. And do it quickly and do it now. Otherwise, in 6 months' time, there'll continue to be small firms going bankrupt, small firms in hospitality, small firms in service sector, small firms in catering, small firms in transport and tourism, taxi companies, all the rest. They will go bankrupt. And that will put more and more people out of work. So I actually think we have to speak up now for those who are saying enough, for those who are saying, let's treat it properly, for those who are saying, let's put proper transmission interruption in place. Let's have decent outbreak management in place. And let's do it now. Let's get on top of this virus. It is, for me, unconscionable that Europe, Western Europe, this collection of countries where there is so much expertise, so much understanding of what's going on, are sitting on a really massive public health emergency, a real public health emergency for which there is not concerted action. If we can get on top of the pandemic, hold the virus at bay, then the rest of life can get on. Cancer care can get on. The necessary steps to ensure that children get the enjoyment they need and the entertainment they need can come. We stop keeping on with threatening to close schools and universities. And we can also return to functioning economies with accessible jobs and employment. I want this done. I want this done now. I am burning with the need to really start proposing as strongly as possible that the public health imperative is put higher and that we don't end up just slipping into a US situation in Europe where we basically give up on the virus. Because once you give up, you know that the actual process of getting rid of the virus and cleaning things up will take many months and will be very difficult. You see, it's the exponential spread. If you have a lot of virus widely distributed in a country, getting rid of the multiple different foci of infection will take a very long time. You can't do it just by spraying disinfectant or throwing around vaccine or whatever other technique you want to use. It has to be done through interrupting transmission. The vaccines will only work if you can get up to 70% coverage or so. And that's going to take a very long time because we've only got 2 vaccine candidates through phase 3, or perhaps it's 1, Catherine, others coming through. And we're not going to have large amounts of vaccines available to enable immunization of everybody in Western Europe and North America quickly. It's going to take until late 2021. And then the rest of the world is not going to take until 2022. And if we don't get the discipline right to push this virus back, the amount of misery between now and when vaccine coverage gets high will be enormous in terms of suffering and death. And I worry about the long COVID. More and more data telling me it is younger, athletic, fit people who are getting long COVID, who find that they can't run, they can't do normal exercise, they can't go upstairs quickly, they can't concentrate, they can't go on doing their reading and their writing, they're not feeling mentally strong, and this is 1 in 20. We've got to stop this. So I'm very, very burned up today about this. I think that everything we've been saying here about how the only way you can do this, get transmission interruption right, is to get close to people. The only way you can get close to people is if you work with local community actors. The only way you can work with local community actors is by building integrated teams, integrated response teams at the local level with strong public health support. But the key thing is your responders have to contain people who reflect all the interests in society: the mosque, the temple, the synagogue, the church, the community organization, the sports club, the local drinking center, whatever else you want has to be there. Because unless we can involve these groups, we know that it will be really difficult to establish effective interruption mechanisms, to be really difficult to get people not to come to work and to self-isolate. I still am in touch with a factory that I visited with Florence in the summer this year. It's dealing with food products. And I met a most amazing, charismatic system leader, guy, Phil, who runs the place. And he described how when COVID arrived, they didn't take their bonuses. They used all the cash that they had to help improve the conditions for the workers. And then they created a fund so that they would pay at 80% of normal take-home pay to people who had to self-isolate in order to break up clusters. And they paid it themselves. The bosses paid it. Why? Because statutory sick pay in the UK is 1/4 of the normal working wage. And these people could not stay at home on 1/4 of the normal working wage. They had no protection if they were made redundant. They had no protection if they were kicked out of their homes. They had no other protection in life here. They were often second generation immigrants. They didn't have big support mechanisms. So they had to go on working. And I just find it extraordinary that governments have not taken it on board, that people will not isolate if they cannot receive enough income support and protection, so that when they are isolating, they don't end up losing 75% of their income. Many people are making this point, and yet governments everywhere are finding it so hard to respond and to deal with it. So I want to keep going on the question of finding it ways in which you incentivize isolation. I want to keep going on the fact that this is part of addressing the inequities associated with COVID. You know, people like myself, well-off people, we're okay, we're fine. We can find ways to work from home. We can find ways to stay connected. We've got our internet access. We've got all the rest. It's the people who just don't have that reserve who are in such a tricky situation. And it's not just in Europe, it's in the US, it's in Latin America, it's in Africa, it's in Asia. It's a global phenomenon. So I'm going on, I'm not stopping. I'm going to continue talking about what this all means. I'm going to continue highlighting that unless we deal with this, other healthcare falls apart, that women cannot access reproductive health. I keep saying it, but it's true. That people who've got cancers cannot access cancer treatment. I'm going to talk about mental ill health. I'm going to talk about the challenges faced by health workers in hospitals or in other units who are just working constantly, and they are absolutely exhausted. And people in care facilities who are feeling oppressed and tired. You know, let us recognize that these are the people who suffer if we insist on everybody rushing around and having social events over Christmas because somehow it is deemed necessary for our sanity to do it. Well, is it necessary for our sanity to have another surge of COVID cases in late January? It disturbs me. So this is what I'm focused on, miserable message for Christmas 2020. But I talk to my children about it and they say to me very clearly, okay, that's 2020, but we might as well accept that we're going to have difficulties this year because we absolutely do not want to be having the same problems next year. On vaccines, I will invite Catherine to give us an update, especially if there are questions about it. I mean, there is no surprises. There's no magic vaccine that's coming available. We are all going to have to learn to accept that for the time being, vaccines are about protecting those with high risk, older people, people with concomitant illness, and that only gently over time will we move to a point where vaccines are going to be part of creating herd immunity or population immunity. So that's my quick stock take. You can tell that I am really burning with the issues, and it's going to stay like that. And it will stay like that, I suspect, for the foreseeable future. Chris Lara, you're here. I hadn't seen you yet. If you are here, there you are. Chris, it's just so nice. Christian, I don't know whether you're still at Duke right now or whether you've gone somewhere else, but let's say you are in the Carolinas. You're watching what's happening across the US. You probably look from time to time at the Johns Hopkins University dashboard with this most amazing stuff telling you that test rate positivity is up, increased over 10% rate, that the disease is so pronounced that more than 3,000 people are dying each day. Do you see light at the end of the tunnel, Chris? I haven't heard from you for some time, so be interested in your answer.
Thank you, David, and hi, everyone. It seems here in the US, it has been a while, but there's many things that have happened since last time. The outcome of the elections, but also the issue of governance and trust on institutions. I think is quite significant now that the first vaccines are being starting to be deployed in different parts. It's a constant message from the government that the logistics of all this is sort out, that is not going to be a big deal, but of course it's going to be a huge amount of resources that have to be invested in order to have population vaccinated. But the most problematic part from my point of view is that people don't believe on the vaccines. I think trust on institutions is eroded, and somehow I think it's going to be one of the main obstacles in order to it's not a logistical challenge, it's a governance challenge as well. And of course, it seems to me that some people just don't talk about COVID anymore. We saw Thanksgiving and what happened, and we are going to see that at the end of the year with the holiday season and people traveling to the mountains and to the beach down to Florida, etc. So let's see how it works in terms of the personal ethics of, everyone has to play a role, but for so many people, COVID is done. And now with the vaccine rhetoric that the vaccine is out there, I think it's going to get worse from my point of view, unfortunately. A positive side is a silver light. The university here, Duke, is a small university. It's a private, small university that actually managed to have classes during the whole semester. And it was very positive, the way that they did the test. But even for running in the Duke Forest, everybody goes with mask, and it's I think people are conscious, but this is a bubble. This is an educated community that is very much democratic community and etc. But you go to other parts of the state and people just go crazy with, well, etc. like social gatherings and so on and so forth. So that's from my side. It's really nice to be here back again.
Thank you. Well, stay with us for solidarity, but we have to keep on venturing outside our comfort zones because just to pick up on what NK has just put in the chat, in my judgment, the only way to address public mistrust is to trust, is to love, and is to connect. The people who are anxious about the pandemic or who are not sure about the vaccine, they're not certainly my enemy, and I don't think they're our enemy. I mean, they're us, really. We happen to be okay, mostly, with the idea of vaccine. We happen to be okay, mostly, with wearing masks and distancing. But I bet even some of us have moments when we're fed up putting on the mask, or we're not sure whether it's adequate, or we're with others wearing masks and then we slip and we let it go below our noses. I think we're all quite frail, we're all quite tired, and we're all the same. So Chris, I think it's lovely that you've picked on trust, and my message to everybody today is try to find the space in your heart to meet up with, to talk to, and relate to the people who've got very different views from your own. Touch them in their hearts, genuinely. Sense into their view of things and work with them. You never know, you might actually be helpful. And what I'm saying to people who are offering vaccines is offer everybody several opportunities to be vaccinated. Leave a gap between them, say 2 or 3 weeks, because a lot of people might say no first time, but they want to look and see what happens to others who get vaccinated. They want to convince themselves because they're not quite sure. Anyway, this is my base view, Chris, and NK, that the way we deal with trust.
Just
is
another issue related to the
What?
economic consequences of the outbreak, and how this economic package that have been promised by the Congress in the US has been delayed and delayed while people are being evicted. And it's incredible to see the food banks, the lines to get food for free. It's unprecedented. I have never seen something like that, even during emergencies in different parts of the world. So this part is also critical because people are feeling they are absolutely on their own, unprotected, and absolutely forgotten, I will say.
Chris, I was just with Catherine Bertini, who used to run the World Food Programme. You might know her just now. And she was telling me the same sort of story. I mean, she's in upstate New York. And she was saying the lines for the food banks in the US are just getting longer and longer. I think this is so important, Chris. Look, if we don't speak out about what we're seeing, if we don't speak out about the fact that this is just adding to the existing poverty of poor people, then who's going to speak out? Who's going to listen? Those of us working in public health, we have to do so. That's what Michael Marmot taught me. He said, us medical people, we have to talk about and speak about the social and economic determinants of ill health. So let's go on doing it. And I think by sharing with each other, this is what we know we've got to do. It might give us that little bit of extra confidence to do so. Chris, what are you going to do over the coming couple of weeks?
Well, we are working on some policy papers on science diplomacy, and I definitely will stay here in North Carolina at home. Yeah. I was in New York the last couple of weeks, and it was impressive to see how the whole dynamics in the city has changed.
Yeah.
I mean, it's a very resilient society in terms of adapting to changes. And I will say that I will be here attentive to what is coming and preparing for the new year, doing some planning, I think.
So good that you're talking about New York. They really learned a lot from their early COVID in March. Our colleague Bruce talked a lot with the officials, particularly for the state. And some of us were able also to exchange. And what's quite special about particularly Governor Cuomo is that he really gets the point about interrupting transmission. He knows that it's not enough just to get people to stay at home. He knows that isolation matters. And I'm very pleased about that. I hope he can hold on. I mean, it's very hard if you're running a state or a city when people are perceiving that it's just a choice between keeping businesses open and having a lot of COVID and closing the businesses and having less COVID. And we have to keep saying it's not, that is not the choice. The only way you can do both economy and businesses is interrupting transmission of this virus. And that requires the ability to isolate. Chris, thank you for your leadership. Really special. Lovely to be with you again. Now, what I'm going to do is to invite quite a lot of people just to make their comments, and I'll go from one to the next. And the idea here is we try to relate what we're seeing in our local situation with what we're seeing globally and what we're experiencing in our families. We're really moving right across the spectrum, and it's quite okay. And sometimes I'll ask you, what are you planning for yourself? Because I think that matters. So Gawaha, please, welcome. We're talking a lot with Canadians recently, and this will go on. We're really, really delighted that you're on the call.
Thank you, David. Always happy to be here. Everything's fine here in Montreal. There is, as I mentioned in my comments, cautious optimism with the vaccines arriving and the first person being vaccinated in Quebec City, followed by Montreal and then Ontario. And I don't know about out west, but I imagine very soon if they haven't already started. Most people are welcoming the vaccine. Of course, there is some reticence, but I think time will tell. By the time it reaches, the different population groups, I think we'll have more data and information. And certainly if the first people survive, then everybody else will be happy, which is good news. Unfortunately, the numbers are spiking everywhere, and provincial governments are shutting everything down pretty much for the holidays. I don't know of any provinces other than perhaps the eastern bubble where things might be somewhat flexible, but the rest of the country is not doing well. Personally, I'm fine. Family's okay, alhamdulillah, across the seas and on this part of the Atlantic, and everybody's staying home. I'm going to be with my mom over the holidays, and basta così. I have one question, David. I'm hearing the Chinese vaccine has arrived in the Middle East, and my family members, doctors, tell me about it. I'm interested. It hasn't yet reached the general population, but doctors are being vaccinated in Egypt as we speak.
Well, I have to tell you that only one vaccine, to my knowledge, has successfully completed all the formalities of phase 3 vaccine trials. Now, I may simply not be aware that one of the Chinese vaccines has also been through phase 3 trials. But the one concern that I've got is a little bit what you're getting at, Gawaha, which is a kind of vaccine gold rush, with the possibility that people are offered vaccines that have not necessarily been through all the testing process. And that's a bit problematic. So thank you for that intelligence. I didn't know it. And I will try to find out more. I have a very good source of information about what's happening in Egypt. But bear in mind that it would be my position as a public health person that the only vaccines that should be used on anything other than carefully designed experimental studies should be vaccines that have been through phase 3 trials and through the regulatory process. And I know that you know what I'm getting at.
Absolutely. Thank you, David.
Great. Thank you. Karen, please. Karen's going to say something that I'm very glad she's brought it up. Karen Kaplan.
What did I bring up?
Oh, it
Was it-
says, Karen says, transmission, exclamation mark. We
Yes.
still don't know what transmission will be like post-vaccination. And I was going to say, absolutely. You vaccinate people with a vaccine. We're not quite sure what that vaccine is doing. What you do is you change the ecosystem within which the virus is moving around, and you do not know what will happen. I had this
Right.
before when we were dealing with birds. This wasn't dealing with humans, with a bird flu. And there were lots and lots and lots of different vaccines coming available for chickens to stop them getting bird flu, but we didn't know what was going on. This is very, very difficult biological context. Is that what you were getting at, Karen C?
Yes, absolutely. But also it's part of this whole campaign thing that Christian Nabarro was talking about in America and around the globe. People who are, either they're anti-vaxxers or they're just confused
Right.
or hesitant in general. Think in a positive way. Even very intelligent people think, once they get the vaccine, they're done. They've been vaccinated. They think the whole thing is over, and they couldn't be transmitting it or doing anything else. And it's just part of this campaign. There is this really phenomenal new collaborative that was just launched, the COVID collaborative with Ray Chambers and all these people from across the US. It's absolutely phenomenal. I think it will make a big difference with the new administration and this collaborative.
Cool. This guy, Ray Chambers, is a magician. He's capable of bringing people together like not many others are. So that's good.
Yeah. Yes, malaria no more, and then some. Yeah.
Thank you, Karen.
Sure.
Let's go. Karen, did you want to say something else?
Well, there has been something else about transmission articles about animals in the U.S. now testing positive for COVID, but maybe if possible, offline or something. I would love to get any information that you have on an update on Iran. I feel like I'm at the end of the year exactly where I was at the first week of February, which is worrying tremendously about what's happening in Iran.
And you should. You should.
So
you should.
I'll close there.
Keep on worrying about Iran, the people of Iran. Or in public health, as you're implying, Karen, life has to be about thinking about people, because all people have the same value, whichever country they come from, whoever they are, whatever their wealth status, whatever their ethnicity. And I look at the numbers in Iran, and I hear people saying Iran's in its third wave. And I just think, what? And you just feel so sorry for people struggling with incredibly limited resources and trying to keep things going. So thank you for making that point. If I find out anything, Karen, I'll remember. Does anybody from the team want to come in? Because these are quite technical issues, and I don't want to, John, if you want to come in, I hope you'll jump up and down. It's harder to see you with all this fancy background that Twee has given us, which I'm just experimenting with as well. But do jump up and down. Anybody who wants to speak. Rebecca, giving up. Come on, Rebecca, tell me what's in your mind.
Well, what just came in my mind actually was worrying about language. I feel like, I've mentioned it before, I think the long COVID, unfortunately, is going to be a really long-term problem in 30 years. And we talk about long COVID in English, but long COVID as a term in Spanish, and then every other non-common language or less common language to English and Spanish. I don't know if it exists. And I bet you it has to be that over 50% of the people infected with COVID probably have some form of long COVID who aren't even going to a hospital and aren't going to even have any way to articulate this, and then are going to be seen as even more weak and vulnerable. Whether they're already poor because of everything that's happened because of COVID, even without having COVID themselves, if they have a family member with long COVID, the whole language even around chronic fatigue syndrome still is with stigma. I mean, I can't even imagine how we're going to get long COVID into the global lexicon. And
Okay, Christmas challenge or end of year challenge is what can we all do to help make sure that people with long COVID syndrome don't get stigmatized. Rebecca, can you do us a favor? I mean, you're in Chile. Are you staying in Chile over the next month or so?
Okay, so one, I never travel over the holidays because we always have teaching to do. We don't
Right.
get a summer, whatever, winter, summer break. But also we usually have summer holidays. It's funny you bring this up because we usually have summer holidays in February, and that's the time we get off, and we can't change our vacation time. But I came to the decision that I can't travel to see my 100-year-old grandma in Washington, D.C. in February. It's too cold.
Yeah.
So I'm trying to move my vacation, and they might be able to grant me a special permission to do it. But yeah, it's interesting to think about all the global dynamics.
Well, thank you for that. Please keep telling us what you pick up about long COVID in Chile, if you don't mind. And anything else. I mean, my Chilean friends are in regular contact with me, people at ECLAC, and we need to just keep watching. Thank you very much indeed. Can we go across? Thank you, Rebecca.
One last thing. We don't have weekends anymore. The whole metropolitan region is back on weekend lockdown. I'll just leave it at that.
What did you just say? You have to repeat that.
Yeah, so I don't want to take any more time, but we just got weekend lockdown. We had weekends available probably about a month or two, and they just locked down the whole metropolitan region again. No weekends, no weekend movement, zero.
Wow. So there's signs that it's coming back into Santiago because you had it so badly before.
Yeah, well, and they're getting concerned about what's happening elsewhere, but it has started to come back a little bit because they started to open things up.
Yeah. I would expect in Chile the virus to be really getting stuck into places outside the big cities now. I mean, I think it was more concentrated in the big cities earlier this year, but I expect you to get similar situation as what we're seeing in the US. Thank you, Rebecca. Stay in touch. Don't, just because it's Christmas doesn't mean we don't answer emails. Tracy. Now, I'd heard this. So Tracy, I'll be quick because we're going to run out of time. Vancouver has ordered a stay in place until the 8th of January. No household mixing, nor dining out. No contact or team sports. No faith gatherings. 3 faith groups in British Columbia have ignored this order. And ski hills are open for pass holders. Very limited day passes available online only. Masks must be worn at all times on and off piste. No mixing ski groups. Tracy, sounds like they're super worried where you are. There you are. Super. I mean, that is suggesting the health department in British Columbia is not relaxed at all.
No, thank you, David. Our numbers have been going up, not as much as some other places, but they are going up. So Public Health Officer, Dr. Bonnie Henry, is coming down hard on everybody. And so people can go out to dine, but only in their own group of maximum of 6 family members, and they can't mix with others. So if that doesn't change, or if the numbers don't settle down, they might close restaurants, but they are trying to keep that that commerce open for the time being. And so we have decided, or our family has decided, that we're postponing Christmas and New Year, and we're just planning now to celebrate in the summer, and hopefully we'll be able to celebrate the flat line as well. So we are just going to get together on Zoom and watch the grandchildren open their gifts. So we'll probably Zoom 2 or 3 times over the holiday period. And a lot of people I've spoken to are doing the same, but there are also those anti-maskers who want to be out protesting. So I think, you know, that's where numbers are growing.
Yeah. Tracy, thank you very much indeed. Thanks for sharing. I did want to just quickly ask N.K. Sethi just to give us a quick assay of what's happening in New Delhi. That's because New Delhi has been difficult. As everybody knows, we've been watching the numbers in New Delhi and wondering why they went up. We think it was Diwali that pushed the numbers up. But would you like to just give us a little bit on what you were saying in your note, in your comment, NK?
Well, in New Delhi, the things are getting better now because the cases are coming down and the positivity rate is coming down. The number of deaths have also come down, but we have yet to see a few more deaths because many of them are still on ventilator.
Yeah.
So let's wait and watch. Let's hope for the best. Things have become a little better post Diwali, but my concern now is about the agitations which are taking place, and people are gathering, farmers' agitation. God knows what's going to happen. That's a concern which we'll have to watch very closely. And there have been elections in other parts of the country, but surprisingly, the cases have not gone up looking at the gatherings. I'm not sure what could be the reason. It could be lower testing, not reporting, or the median age of people would be less. It's very difficult to comment at this stage, but it's a different situation.
Thank you very much indeed, NK. I think it's the type of gatherings that has such an impact. You know, during Diwali, people are together for quite lengthy periods of time. At least we think that that leads to more spread. We're not quite so sure that's the case with elections. But I was reading about the farmers' agitation, and I must say that would get me quite worried, because you're going to have a lot of farmers all camped together in tents or on trolleys. It's cold, and I'm not sure that that's going to be an easy situation. However, I can't say any more. Everybody, I think what we're seeing is just a rising number of cases and real challenges for authorities in dealing with it. Very difficult trade-offs being made, whether you're in the US or in Canada or in India or in Latin America or in Europe. Let's stick together and keep doing what we can, and we'll stay in touch with you. Over to Twee now, and then to our colleague Chris Shipton, who's going to show us what he's up to. Twee first.
Thank you, David. So I said there would be a second surprise. So I am very pleased to say that we get to bring Nazim back with a second song. It's not a nice time in relation to COVID, and I suppose what we've done here is started with a really positive song, and we're ending with another positive song, which is what I call sometimes a difficult sandwich, where you put two good things at either end. And it's not just a positive song either. What you've heard from Nazim is that it's full of solutions, people connecting, coming together, and what the impact his songs have had in his home country. So over to you again, Nazim. Welcome back. Welcome back.
Thank you, Tui. Thank you, everybody. Here goes the second surprise. And before I play the surprise, I just want to say, in a moment like this, people are the solution, and we can get through this together. Yeah, and big ideas can help. So we should never underestimate the big ideas. All right. The song I'm performing now is called Big Ideas. All right, let's go. Yeah. Big ideas right now can change the world. Yeah, yeah. just this moment right now can make a difference. Yeah. This is not a paper exercise. It is everything that we need right now. Only you and I can change the world. Eh. Only you and I can make a difference. Eh. What am I? Let us channel our energy to a brighter future. Yeah. Cause together our collective thoughts will succeed. Let us break boundaries and dare to be different. Oh, different. This is not a paper exercise. It is everything that we need right now. Only you and I can change the world. Only you and I can make a difference. What am I? No matter how complex things are now, yeah. Let us use this time as a time for change, yeah. Cause together, our collective thoughts will succeed. Let us break boundaries and dare to be different. Oh, different. This is not a paper exercise. It is everything that we need right now. Only you and I can change the world. Yeah. Only you and I can make a difference. Yeah. Let us do it now. Now, now, now. Yeah. Let us do it now. Now, now, now. Yeah. Yeah. Thank you very much. Thanks a million. Thank you, everybody. Thank you so much. Much love from everybody. Thank you very much.
Nazim,
Big love.
Nazim, can I just can I get through to you? I just want to ask you one question. What is your big idea for next year, for 2021? Have you got one?
Yeah. What I think for now, the most important thing that I want to see next year is victory for humanity. I think we have suffered too long, and I think we deserve to celebrate victory, and we can only achieve that together as one people and one world. You know, not by little groups and everything. We have to come together as one, and then we can be able to defeat this very, very scary enemy that is making all of us uncomfortable. Yeah.
Count us all in as your supporters. We're all together with you. Remember that, all of us.
Yeah.
We send you so much gratitude and love for everything you do. On behalf of all of us, thank you, Nazim. It's the first time I've been able to say it to you directly. Thank you for your inspiration to so many people with your beautiful voice. Thank you.
Thank you. Thank you, David. Thank you so much.
And to those working with Nazim, thank you also for coming into our lives and bringing us this magic. It's really special.
Most especially Vicky Doyle.
I was
She's the machine
slightly
behind all of this. You know, she's doing a lot.
Vicky Doyle. Vicky Doyle.
Yeah.
I was
Vicky,
reading
Vicky,
one of
Vicky,
your
Vicky.
papers that you were writing on community action. So strong what you're doing. Thank you.
Thank you very much, David.
Thanks a lot, mate. Let's go to Chris Shipton, please. Chris, could you show us your screen and tell us what you picked up? Wow.
I just the Christmas debate continues in my family. One little nugget from my sort of scribing travels is that I did something for that involved a speaker from Florida Tourist Board, who are very exciting about having the Super Bowl in February. And I think it will be very interesting to see if that change of leadership at the top is going to be a tough call to cancel the Super Bowl.
Very interesting.
I decided not to pick an argument with them because it was right before. Anyway, sorry, I feel like my wittering in comparison to that excellent music was, you know, the music was fantastic, and it was so great to hear some music on this call as well. That was really amazing.
Well, I hope you can incorporate music into your pictures. I'm sure you can find a way to do that. Excellent. Lovely to see so many lovely things in your picture. Thank you very much indeed. Everybody, it's that finger, that hand in a rubber glove squeezing coronavirus. I can't quite see what's happening as a result of the squeeze, but it looks like it's not surviving. Very good. I love it. Thank you. Thank you for everything. Twee, did you want to say anything else before we close? Otherwise, I will. We're really grateful to everybody being here. But I think we have to move on. Yeah, Twee.
Thank you. Thank you for joining us today. It's the second to last session for Series 2. We'll be back again Friday morning for the last of Series 2 and the last for this year. I'm putting in the chat the link to our survey. Please complete that if you haven't, so we can build Series 3 together. If we don't see you on Friday, we wish you very safe and happy holidays.
And with that, from all of us to all of you, we're with you all the time. Use the WhatsApp group or whatever else. And thank you for everything you're doing. You're all making an extraordinary difference, and I think you know it. With that, bye-bye from all of us. Bye.